My name is Alicia Sapatic. I'm a livestock and feed extension specialist, and in this video we're talking about algae identification and treatment. So there's two main types of algae broadly when we speak about it, planktonic or filamentous. And so planktonic typically are ones that you can't grab in your fingers when you scoop your hand through the water. The filamentous are the grass or the hair-like ones that when you scoop your hand through, they'll come with your hand and be like a mass on your hand itself. They can vary in color, both of them, either green, some are more blue type in color, or red, sometimes even brown. The filamentous ones typically aren't toxic and are more green plant-like structures in a sense. The planktonic ones though are the ones we often are concerned about because they can produce toxins that are harmful to livestock. And so these ones can look like pea soup across the top of the water body. They can look like grass clippings in the water column, or sometimes they can have a blue-green type paint sheen across the water body itself. One type of algae, the planktonic type, so some of those can be what we call blue-green algae or cyanobacteria because it's actually a true bacteria, not necessarily an algae. So those type can produce toxins that are toxic or deadly to livestock. And so it's really important to know what type of algae is growing in your water body so that you can manage it effectively. Oftentimes, the hand grab method is the easiest one to broadly identify the types of algae because within those and outside of that, there can be aquatic plants like duckweed and things like that growing in the water body. But in those two broad species of planktonic versus filamentous, if you grab, it slips through your fingers, it's typically that planktonic. If it's not, that would be that filamentous type. And so the filamentous, not generally toxic, the planktonic certainly can be. So those would be ones to watch for. There is a laboratory test for that toxin itself, but sometimes can be inconclusive, so it's best to err on the side of caution. So first and foremost, if we can prevent the algae growth, that's the best course of action. So there are beneficial management practices like keeping the livestock out of the water body, utilizing troughs and tanks, which cattle actually prefer. Also keeping that water moving, so aeration is very important for that, so that that algae doesn't have those favorable conditions of that warm, stagnant, nutrient-rich water. So there are several different treatment products. Most of them are copper sulfate base. For things like duckweed or aquatic plants, there are registered herbicides that can be used in those cases, but they aren't generally something that we would typically go and treat for. The green algae, those ones aren't generally harmful either. So really we're looking at the blue-green type of algae or those planktonic type. So there are registered copper sulfate based products available. And what we're looking for is that they're registered for use in farm dugouts and that we use what is on the treatment label as far as the treatment rate and the application method. So it's best to check there because some products will differ in what they recommend. And then the important thing to remember after treating a blue-green type of algae, remove the livestock for 10 to 14 days to allow those toxins to dissipate so that your livestock aren't at risk of consuming the toxins. If you are monitoring your water sources throughout the summertime, try and keep ahead of where the algae are growing. If you notice a blue-green algae type in a source or in a pasture that you're going to be moving to soon, perhaps you need to treat that, allow those 10 to 14 days for the toxins to dissipate and then be able to turn your livestock out onto it, or else adjust your grazing plan as such. So always keeping ahead and keep monitoring your water sources. For more information on identifying algae or treatment options available, you can call our Agriculture Knowledge Center at 1-866-457-2377.